Hello. Welcome back to the Injury Podcast, Season 2. My name is Dr. Craig Selinger, chiropractic physician, and we today are going to talk about head injuries. And we are fortunate to have a leading expert, a neurologist, that is going to be explaining, demystifying what head traumatic brain injury is, concussions and so forth, signs and symptoms, and a whole lot of other stuff that we're going to get into. But first, I want to review a medical disclaimer. This podcast is for general information purposes only. It's for educational purposes, and it does not constitute the practice of medicine, medical advice. No doctor-patient relationship is formed during this podcast. The use of this information for this podcast is at the user's own risk. This is intended to be not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should obtain a medical advice, diagnosis, and treatment from a physician, and they should seek medical professional advice if they're going to try any of these type of therapies that we're going to be talking about in the podcast. Okay, well, without further ado, I'd like to introduce our guest. We are very fortunate to have Dr. Angela Adams, board-certified neurologist, concussion specialist with extensive training also in behavioral neurology, rehab, and memory disorders. She is an expert in this field, and I'd like to welcome you to the podcast.
Hi, Dr. Selinger. Thank you for having me.
Great. And you're right now in New Jersey. I'm in Boca. How's
It's a little colder here.
are the trees? I used to love the fall foliage in the Northeast and New Jersey. Are the leaves starting to change color yet?
Yes, they are. The leaves are falling. And you have
Nice.
the luxury of saying that because you are nice and warm.
Yeah, I'm looking outside the studio window here, and it is sunny. There are palm trees. It's at least 80 degrees. It's wonderful, and a little bit of breeze because we're close to the ocean. So,
Rub that in. That's it.
sorry, making you jealous here. So, thank you again so much for being on the podcast. And so many people I'm a chiropractor. I treat a lot of people that have been in car accidents, and they come in with headaches. They come in with memory issues. We're seeing some changes with cranial nerves. But before we go into some of those things, a little bit about you. What inspired you to become a neurologist and specialize in working with people that have had head injuries?
When I first went to medical school, I always gravitated toward neurology, and I had some really good uh, professors that taught me that were so interesting. And I loved everything about medicine, but I loved the brain. And I was always very curious how the brain worked, how that I felt like the brain was the most important part of the body. And then when I started doing my neurology residency, I was really um, taken by behavioral changes because of injuries. And
Mm,
I just became so interested in it. And I decided that I wanted to do a fellowship in memory disorders, neurobehavioral, and neurorehabilitation. And it was wonderful. And then when I went out into my private practice, I saw such a need because
mm,
it just seemed that people would say, especially with concussions, and I always was very interested in, I'm a big sports fan. So I always interested in concussions from football players, things like that. And it just seemed like people weren't getting treated.
mm.
And it was like, oh, it'll go away, it'll go away. And when I first started out, that's sort of what it was. Oh, a concussion, it heals in a couple of weeks. You don't have to do anything about it. And people were having symptoms and just not getting treated. So I just naturally gravitated toward it, really.
Yeah. And we see patients in our office many times that have been to the hospital. They might have hit their head, or they have headaches and they get a CT scan. They come into my office and I do my exam and evaluation, and I find that maybe by doing checking their visual fields, they're getting dizzy, they're having balance problems, they're having headaches, or this is provoking these things. They can't do best tests. They can't do some balance tests. And they say, well, doctor, how can I have a brain injury or possibly have a brain injury? I went to the hospital. I had a CT scan and they did an MRI and everything was normal. How can that be? So can you speak to a little bit about that?
Sure. So I think that it's important to first for people to understand what a concussion is.
Mm,
And so a concussion basically is when there is some kind of impact that someone has that is enough force to disrupt brain function temporarily. And it disrupts it. But what happens is that force can come from a blow to the head, uh, upper body or head being shaken forcefully. It can happen with something hitting the head or the head hitting something, a hard surface. It could come from acceleration, deceleration injuries where uh, there's a sudden change in speed and then the brain basically hits up against the hard skull.
mm,
What happens is there's if there's an impact and there's enough force to actually impact the brain has to absorb that force, and that disrupts communication. And so what happens is when that communication between individual nerve cells is interrupted, you start to get these symptoms. And you go to the hospital, you go to the emergency room, like you said, they're looking for urgent kind of problems. If somebody's bleeding in their brain, if they have a contusion, a skull fracture. So they'll do a CT and they'll say, great, there's no bleeding, fine. No kind of emergency issue. If your symptoms don't get better, follow it up. But that's the problem. Then it ends there for the emergency situation. But with a concussion, it's much more subtle than if you have a brain bleed or a stroke or things of that nature. And sometimes that gets dismissed.
mm. Yeah. So just to, I sometimes tell patients that their brain could be like a ping pong ball. And even if they don't hit their head, the brain shifting back and forth, I have my little brain model here, shifting back and forth and hitting the skull can cause that impact, that injury. So, yeah, so a lot of people don't understand that. And there are even some physicians that I speak to that are internal medicine or different areas of medical practice, and they seem to brush it off as well. What are some signs and symptoms that someone had a concussion and that you might see? The person might notice themselves. And then what are some things as a chiropractor or another type of physician that are easy signs that they could see that, hey, this person has a concussion and needs to have a workup done?
Well, one of the things that's so interesting is that most people, lay people, doctors say, oh, if you had a loss of consciousness, you had a concussion. But you don't have to pass out to have a concussion. Uh, and what I look for are early signs, what other people might observe in the immediate impact, and then symptoms that the patient might have. So there are like early signs and symptoms. Early signs could be they did pass out, or they just had a change in their mental status where they were less responsive right after the injury, or they were acting a little bit odd, inappropriate behavior, slow thinking, things like that. They could have post traumatic amnesia, which basically just means they can't really remember the event or some time after the event. They could have incoordination where they just look a little bit like they can't follow commands or move properly. Sometimes they can have this tonic posturing that looks like a seizure.
Mm,
Then what can a patient be feeling early on? They can be having slowed thinking, feeling dazed, disoriented. Uh, they could have headaches, dizziness, balance problems, vision issues, sensitivity to light or sound. Uh, a lot of them say, I just feel like my brain's in a fog. So this
Mm,
mental fogginess. Emotional, they could be more irritable. They could have more mood disturbance where they have like more anxiety, depression. They don't know where it's coming from. Oftentimes, people have sleep disturbance early on. And so those are like the basic things that you look for. And those are real good indicators that somebody did have an actual concussion.
great, great. And what would you say to people listening out there? What are some red flags that somebody should immediately go to the hospital if they're experiencing?
So if somebody had a loss of consciousness, I would say go to the hospital, get it checked out. Um, if they're having things like worsening headaches or pretty severe headaches, you should get that checked out. Vomiting. Sometimes people can vomit just from their head being shaken up, but if they're vomiting more than once or a few times, then I would want them to get it checked out. If they have amnesia or memory loss for time before the accident, like more than 30 minutes before the accident, I would get that checked out. If they had a dangerous accident, like with a car accident, if they were a pedestrian, if they were on a bicycle,
Mm,
if the car rolled, or if they were thrown out of the vehicle. If there's a fall that they have that's more than a few feet, if they fall down more than 5 stairs, those are things that you say, okay, let's just make sure there's not something more going on. Sometimes if a loved one has an accident, they may not be totally aware of how serious their issues are. So if you notice that somebody's more drowsy or they're more repetitive, they're not thinking right, you'd want to get that checked out. And then there are definitely, if somebody is having uh, focal neurologic deficits, like they're weak on one side, they're having sensory issues, that should be checked out.
mm,
If you see anything that has any indication of somebody having a kind of fracture, like a skull fracture, you would worry about that. And like you could see if there's blood in their ear, if they're having fluid coming out of their nose, if sometimes there's a thing called a battle sign where they have like bruising behind their ear, or raccoon sign where they have bruising around their eyes.
mm.
Those absolutely should be checked out.
Okay. Yeah, I think in my office, I think that some of the most common things we're not seeing as severe head trauma as often as a hospital would or you would, but we see changes with their ability to their eye movements are affected, and it will also provoke headaches. That's really common, or dizziness, nausea, those kind of things. Balance issues when we do some preliminary checks that's been affected. So those are some common things we see. And I always remember I get scared whenever I handle or take care of a patient with head injury, because I remember the story of Natasha Richardson, Liam Nielsen's wife, who went skiing, and she wasn't wearing a helmet, but she fell down on a bunny slope and had a headache, and just later went back to the hotel and fell asleep, and she passed. So it's just something I think we have to pay so much attention to and not just brush off. And that's why I've tried to learn more about this area of practice, so I could possibly be able to make the right referral to help people.
I think you're so right about that. I think it's really important when people have symptoms that they tend to dismiss, uh, headaches, feeling nauseous, the vomiting, the not feeling right. If you are not feeling right, get it checked out.
Mm,
And I think that is, you know, imaging, I think, is very important to rule out the more serious issues or issues that need neurosurgical or medical attention. And so I think that especially in the early stages of a head injury, people should get it checked out.
okay, great. So outside of imaging, and let's say the images come back and they're negative in the hospital. for brain CT scan, MRI. You've done an evaluation, and you suspect a concussion. What are some other tools that you can use to kind of gauge to see this more functional related injury, and be able to document that?
So a concussion is a clinical diagnosis, which basically means it's up to you and your doctor to really come to that conclusion based on the history of what happened to you, your symptoms, and a good neurologic exam. And so I go through that with the patient. When I first see somebody, the major thing that I want to know is, did you have a concussion? Are there other things that are affecting the concussion and things that I can treat? And what can I do to help you get better as your brain is trying to heal from this concussion? And so I go through a step-by-step process to really get a good understanding, that so that the patient can get a good understanding, and then we can work on treatments to really help them.
Yeah, and in my office, and I think I know we both use this impact test, where I'm able to have a patient do a test on a computer, and we're able to test memory, reaction time, and a whole host of other different things. And it's something we've done over the last year and a half or so, 2 years in the office, and it's been very helpful in one, us finding those changes, two, documenting improvement, and being able to educate the patient on what's going on as well.
Yeah, I use impact testing all the time. I use it basically as an extension of my mental status exam. So as I'm evaluating the patient, and if they're complaining of memory issues, problems with attention, focusing, slowed thinking, memory issues, feeling forgetful, not being able to complete tasks, then what I do is I'll do the impact testing on them. And it's really just 20 to 30-minute computer-based testing that tests visual, verbal memory, attention, processing speed, problem solving, impulse control. And it's fantastic because it gives us a good starting point. Where is that patient now? And if somebody's had cognitive symptoms that are interfering with their daily life for more than several weeks, that's a good indicator that they should be getting further testing and treatment. Formal neuropsychological testing takes hours, it's costly, and it's sometimes hard to find a neuropsychologist who will do all that testing. And so impact, along with my exam, is a really good way for me to see where the person's having problems, and then I can start them on a course of therapy, cognitive therapy, which is like physical therapy for your brain, do a 6-week course of that, then repeat the testing. And so I love impact because it's not just where the person is now. With serial testing, I can track how the treatment is helping them, how they are improving. The patient can actually see, okay, these are objective findings that we're seeing. What I'm feeling, you're seeing that on the impact testing. And that's really helpful for them to feel more confident that these are real symptoms and that they can improve. Also, I think it helps me with figuring out what they can do, work accommodations.
Mm.
Also, it helps me tailor my therapy where there are problem areas. And the other good thing about impact is that it basically gives you a comparison between normal controls of the person's age. So you can see where they are at, not just with their pre-injury level, but where they are at compared to other
Hmm.
people that haven't had a head injury.
Yeah, I like that about the test. You could see how they compare to the population, and of course get a baseline and then document the improvement. I think it helps the patients too. They see that they're getting better, and maybe they're emotionally going to be more willing to continue with care and treatment. And they also say, hey, this isn't just something I'm making up. This is
Right.
something that's actually happening. I hear from people often that, hey, this is just in my head and it's something I'm just making up. And when we have some tests that we can show the patient, hey, this is where you are. This is how you compare to other people. In my office, it helps me educate the patients as well and get them feeling confident that we're going to take the next the move forward in their treatment and address these areas.
I have the same thing where people will say to me, I knew that I was having that kind of problem. Oh yeah, it's like a light bulb goes on and they feel um, something tangible that they can hang on to. And then it gives them goals also.
Mm,
And this testing is really, it's been around for a long time. It's been used and is still being used with athletes, high school, college, professional athletes. And it's a really good standardized test that helps us give objective evidence. So I think it's really been quite helpful in my practice.
great, great. And something that is unique about you is that you also have an extensive background in psychiatry, and you're certified in psychiatry, so you can also address another component to this, which I think is not really understood by most neurologists, but at all. So
Yeah.
how does that help you in your
So
practice?
just to back up, every neurologist has training in neurology and psychiatry. We're certified by the American Board of Psychiatry and Neurology.
Okay.
So in your regular training, every neurologist does psychiatry and every psychiatrist does neurology. I did a fellowship in behavioral neurology, which is very much similar to psychiatry. Um, and so I just have more of an interest in it. And I don't think that there's really much of a difference between neurology and psychiatry. I think that traditionally neurology is problems that you can see on on imaging, like a stroke, but psychiatry is sort of problems that you can't see. And with concussion, that sort of blurs the lines. It's a similar thing, and I think that when we talk about concussion and psychiatric issues, you can have mood disturbance or mental health issues because of the actual traumatic brain injury. So the injury to the brain and affecting that area of the brain that deals with your mood and your personality can be affected, just like your balance areas are being affected by a brain injury, or you're getting headaches from a brain injury. And then to top it all off, as a contributor to that is all the stress that comes from the incident itself.
Mm,
Fear of driving, the financial stressors, the fact that you have all these symptoms and you can't participate in your normal life and be your normal self. And then compounding that is if somebody has previous problems with mood issues or mental health issues, all those three things, the psychiatric issues from the injury itself, from the stress surrounding the injury, and then pre-injury psychiatric issues, all make it harder for people to get better and even for their other symptoms to improve. So if you do not look at their psychiatric problems or the changes that occur with this head injury from a psychiatric perspective, you're missing a lot and it could interfere with their improvement and their progress.
yeah, in in my practice, I've seen patients have problems at work, problems at home in relationships after a concussion, and it's sometimes it's hard. People don't kind of tie the two things together. They think an injury, oh, it's just it's like a herniated disc in the neck. It's just here, and it only affects this area, and they don't understand the multiple spheres that it can affect in a person's in a person's life, actually. So, um, how can somebody that has gone through this kind of injury, how can their friends and family support someone that has had a concussion or TBI?
I think it's really important. There have been clinical studies that have shown that a positive outlook, positive talk, um, understanding what people are going through and saying that you are getting better, you can get better, that really helps in recovery. So support is so important. I find that uh, the patients themselves, I don't know if you have the same experience, but the patients themselves seem to almost be apologetic about their symptoms. And, they just want to get better, but I think they feel bad a lot of times that they're causing their loved ones to not see them the way they usually are. A lot of people say to me, I was the independent one. I did everything, and now I'm having to rely on people. And I think it's really important for uh, the loved ones of people who have had a concussion to really understand that and to give them the grace of uh, understanding and letting them work at their own pace and not making them feel like, oh, you should be better, that kind of thing. And it may be just because people don't understand it.
Mm.
So, uh, you're out there uh, trying to help your patients understand their own issues and families. And I think that more of that has to happen.
What do you usually recommend? I know every case is different, but when people want to get back to work, let's say they work doing a physical type of occupation, maybe they work in construction, and then also people that work, maybe they're an accountant, they work with a lot of numbers and figures, doing a lot of quantitative analysis. What are your recommendations usually with patients when they're wanting to get back to work, when it's okay to get back?
Well, it is really individualistic. And what I normally do is, when somebody first has a concussion, we talk about relative rest, right? Where for the first 2 to 3 days, uh, you just want to decrease the metabolic demands on the brain so that the symptoms can stabilize. And then after that, I basically do a gradual increase in activity, whether it's activity at home, work, play, as people can tolerate it. They should know that with any kind of physical or cognitive activity that may slightly worsen their symptoms, but that is all part of recovery. And so it's a gradual increase. And what I basically do is I'll say, try something. If your symptoms start to increase, stop, take a rest, then try it again. But I have them do it in a graded fashion so that they're not overwhelmed or their symptoms do not get too bad. And that usually really works. And so if it's at work and say they have a lot of computer time, we talk about accommodations basically for them, work, school, whatever it is, so that they're not aggravating their symptoms, but they're slowly increasing the amount of activity that they're doing and bringing their symptoms along slowly so that hopefully their symptoms can slowly improve as they're advancing their work and their school.
Okay. And in terms of people getting back to the gym, you're in South Florida here. A lot of people uh, go to the gym a lot and work out. In terms of being able to go back to the gym and work out, same kind of philosophy that you would
Yeah,
recommend typically.
exercise. I know you know this. Exercise is excellent for concussions. And so even like in the first week after a concussion, I usually recommend if they can do it, 20 minutes of light aerobic activity starting out like 3 times a week. And it's being on a stationary bike, walking on a treadmill, things like that that can really help improve their symptoms. That the exercise itself can improve all of the other symptoms, the headaches, the cognitive issues, the balance issues. And sometimes if they have significant balance issues, I'll have them start to do that with a therapist,
Mm-hmm.
under guidance, so that they don't injure themselves more. But uh, then they can increase that exercise as tolerated. And it's really, I think, very important in somebody's recovery to start exercising early.
Okay. Great. Now we spoke about some things that that can be helpful and some guides. What are some things that people after a concussion should absolutely not do, like out drinking alcohol or any other things like that that might be harmful or worsen their condition?
The worst thing somebody can do is have another head injury while they're trying to recover from the first one. That's So they have to really avoid any activity that is a risk for a head injury. They should avoid any activities that significantly make their symptoms worse. Uh, and what I wind up doing is telling people what things they should do.
Mm,
So they should have regular meals. They should eat appropriately. They should have good hydration, uh, exercise, as we talked about, and I'll give them guidance on the specifics of exercise. Sleeping is so important. Most people have sleeping problems after a concussion, so it's really important to practice good sleep hygiene to try and get that sleep back to normal, because that will affect every other symptom as well. And they, like you said, they should avoid alcohol, any substances. They should also avoid excess caffeine. So those are just sort of my major things that I tell people.
okay. And one thing you mentioned, which we didn't touch on that much, but there's a compounding effect. If somebody had one concussion, let's say 6 or 8 months ago, and then they have another one, that how does that affect the brain?
So when your brain is trying to recover, like if you think about what happens to the brain with a concussion, it's basically a disruption in the function of the brain at the cellular level, where the nerves can't communicate properly with each other. And as your brain is trying to heal and realign, which it really can do, if you give it another insult before it's healed, it sort of compounds it. So it makes the healing process longer. If there's more damage, more significant damage, where there might be some microbleeding or shearing or tearing of the neurons, which are in a more fragile state from the first head injury, then that could be more severe symptoms and a longer recovery.
Okay. And if there's someone out there that's struggling with a concussion right now, what advice would you give them?
I would say see somebody who can really treat all the symptoms. It's really hard for the person themselves to try and manage all these symptoms, and they need an advocate. They need a healthcare professional who can really walk them through it and guide them and be their partner in this. Uh, and they have to, I think this is so important, is for people to be kind to themselves and treat them like they would probably treat a loved one if they had a head injury. People tend to be very hard on themselves and just want to get back to normal. I would really tell them that it takes time. Your brain wants to heal, but it takes time. And there are things that can absolutely be done. You don't have to just sit and wait for your brain to heal. There are things that can be done to make you heal faster and better and more complete.
Right. I know some neurologists also recommend psychological counseling for patients, of course, physical therapy as well, and possibly maybe a occupational therapist too, if necessary. So those might help. That's why it's, I think, important to get checked and don't go it alone. And
Right.
that's a very smart advice. So before we wrap up here, and I appreciate you coming on the show, we have a little tradition here at the Injury Podcast where we have behind me here. Can you get that? We have all these different tumblers from superheroes, and to us, the Injury Podcast, we let me Let me go on the side a little bit. I'll be out of frame. I'll go that way. Okay, thanks. Thanks, Ben. So we have all these tumblers, and we want a comeback or something, a comeback symbol. And I think superheroes do that. And I appreciate the information that you've given to our audience today. And what, if you would like to pick one of these, I could mention some of them off. I don't know if we can get them on the camera. We have a Superman one, Wonder Woman, Batman, Captain America, Thor, Hulk, Deadpool. I know we have another one that's not on here, but I can also send out to you a football one, Notre Dame Fighting Irish. So whichever speaks to you, let me know, and we would send one of those out for you for being a superhero and helping people recover from injury and making a difference in their life. So which one speaks to you?
Well, I would have to do the Notre Dame one where I went to school. And I also, Notre Dame says their little thing is, what would you fight for? And I think that you and I and all the people out there are fighting to help people with concussions. So that's what I would love.
Awesome. Okay, so we'll send that out to you. Dr. Adams, I appreciate you coming on the show so much and shedding light on something that a lot of people don't know too much about, and it could be really serious, and it's important for us to get checked out there. So you guys are not alone out there in YouTube land. You need to get checked out if you're having any of these symptoms. You're not alone. So thank you very much for tuning in today. And like I say all the time at the end of the show, like, follow, subscribe. See you on the other side. Let's get strong together. Okay.